Okay, now we'll go ahead and get started. Well, all right, welcome everybody to our June Utah Children's Care Coordination Network meeting. We're happy to have you all here today. We'll start with some announcements, and then today we have a mini autism mini module from Sylvia. Then we'll move into our learning session today, which is all about trying to understand Medicaid better and mental health services offered through Medicaid, along with the Medicaid carve out what some of the differences are in those things. And then we'll try to wrap up right around 9:30. So for announcements today, I emailed this out over the listserv, but I wanted you to be aware about this new virtual classes that are available to help build skills for transition from pediatric care to adult care. And this is geared toward teens and young adults. So you can see here the classes meet weekly, or sorry, the second Wednesday of every month from 7 to 8 p.m. You can find out more by going to this website, which I will also drop in the chat. And then, And then that's offered through the Intermountain Children's Health. In addition, I sent out over the listserv this Mastering Medicaid flyers. So there's some upcoming trainings offered through the Office of Early Childhood. And it's going to be in June in Provo. That's an in-person 3-hour session. There's going to be one in Park City in early July, and then there's going to be one offered virtually, and that will be in Spanish. So Lauren is on. Lauren, do you want to speak to this just a minute? She's the one that's doing the trainings.
Yes, absolutely. Sorry, my internet is having trouble, or I would be on video. But yeah, these are trainings for really anyone working with families, whether for care coordinators, MAs, other clinical staff, early intervention, home visitors, really anyone, working with families with health coverage. We go through the application really like step by step and teach some tips and tricks for getting that process to move along a little faster, documentation, and then also the recent and upcoming changes with Medicaid, so that our families are prepared for those changes as they come down the line. So yeah, like Athena said, we have a couple scheduled already in Provo, Park City, and then virtually in Spanish. Please go ahead and register for those if that is interesting to you. And then we also have ones we're working on scheduling outside of the Wasatch Front, like in Tooele, Southern Utah, and somewhere else that's I'm blanking on now. But if this sounds something that'd be interesting for you, for your team, anywhere, regardless of where you're at in the state, feel free to reach out to me, and I would love to work with you to schedule something in your area as well. So feel free to reach out to me with any questions. I'll drop my email in the chat.
Something as a planning committee that we had also talked about was offering this Mastering Medicaid workshop in place of one of our monthly UCCCN meetings. So it wouldn't be exclusive to UCCCN members, but it would be a way to hopefully have some time blocked out, or time that you already have blocked out, utilizing it to attend this. So I'm just going to launch a quick poll on that. It would be either replacing our October or our did that launch? You guys seeing the poll? Okay. It would either be replacing our October meeting or our November meeting. It would be in Salt Lake at the main Utah Department of Health building that we met at last time in person last year. But and it would be on a Tuesday. There wasn't space available on a Wednesday. So it would be a little bit of a change up to our normal monthly schedule. But we just wanted to gauge interest in this and having a separate meeting scheduled for UCCCN, or if you had already participated or were planning on participating in one of the other workshops scheduled. We didn't want to duplicate that too much. So I'll just give that poll another second, while we move into our getting screen switched over, Sylvia to go ahead and present what she has prepared for today. Sylvia, are you able to share? Yeah, there you go.
Good morning, everyone. Today, I wanted to present on recreation, leisure, and social resources for families with children with autism, given that we're in the summer break for many of our families. Our autism mini modules are aimed at improving quality of life for children, their parents, and others who advocate for people with autism. And I'm sorry, again, my name is Sylvia, and I am the DAC Care Manager. The first slide I wanted to present is on benefits of recreation for children who have autism. And here we have some of the benefits. I always like to mention to our families, our parents, that adaptive recreation has trained staff to work with children with special health care needs, creating safe boundaries along with positive reinforcement. Children get to play and be themselves, focusing again on letting them be kids. It can also release stress, decrease anxiety, help with depression. Children can succeed in this type of environment, increasing self-confidence, transferring to other parts of their life. It could also help with building friendships and increasing communication skills, not only for the child with special needs, but also other members of the community. Educating others that our kids are very capable and have a lot to bring as well. The first resource that I wanted to share was the adaptive recreation through Salt Lake County, and they also have this type of program in other counties as well. It allows for a disability fitness pass. The disability fitness pass is for the residents who have permanent disabilities and want to bring one assistance with them for free to the parks and recs facilities, including the rec centers, pools, ice rinks, when accompanied by the pass holder. They also offer discounted rates. Offering private and group lessons as well as adaptive swim. I always share with our families the importance of swim lessons and water safety. Children with autism are more likely to die by drowning than the general population. For families who have kids who receive free lunch, they may also qualify for the youth and sports scholarships that are offered through the rec centers as well. The second resource here is the U of U Adaptive Adventure Cap. This is for children and teens with level 1 autism spectrum disorder. It's a recreation-based program designed for children 8 to 12 and teens 13 to 17 with level 1 ASD. The camp offers a unique approach to building self-care, social connections, and social skills. The website offers dates and costs for the camps, and families can also visit the camp blog for additional details. Then we have the Utah Parent Center, which is great, and a lot of the resources that I'm sharing today are also mentioned here in this resource guide for 2026. It also includes tips for creating inclusion for any community resources. It provides resources by county, so if you're needing to look up resources for a family for a specific county, this is a great resource guide. And it includes things like rec centers, dance lessons, music therapy, social groups. It's just a great resource for our families. Then we have the Adaptive Arena, which offers adaptive team sports in Bluffdale for all disabilities at no cost to our families. So if cost is a barrier, this is a great resource. Another resource that I share with my families quite often is the America the Beautiful Access Pass that covers entrance fees and standard amenity fees at thousands of recreation locations. The Access Pass is valid for the lifetime of the pass holder. Families will need a statement by a licensed physician that includes the individual has a permanent disability that impacts one or more aspects of their life and the nature of the limitations. This is a free pass. However, if the family wants a physical pass, there is a $7.50 fee for that physical pass. Our families, the letters that we give our families in our clinic just states that they're seen in our clinic, that they have a permanent disability that limits one or more aspects of their daily life. Our physician signs it, and we haven't had any issues with our families accessing this pass with that type of letter. The diagnosis isn't disclosed in the letter. Then we have Autism Outdoor Utah, and I love this one. It's a program dedicated to getting autistic individuals outdoors, having fun with a variety of therapeutic activities throughout the year, many of which are free or low cost for families. They offer programs not only for kids with autism, but also their parents, such as parent-only hikes. One is coming up called the Hike and Restore for Autism Parents. They offer outdoor therapy groups for kids and teens, parent support groups, and parent retreats. And it's accessible and inclusive, mostly based out of Salt Lake. The last time they presented for us, they were working on expanding to Utah County. So if you visit their website, you'll be able to see the locations and dates and times for their activities. Then we have Camp K. Which is the Catopolis Stream Foundation. It services children's, teens, and adults, offering a variety of programs year-round, including summer camps, community-based programs, equestrian programs, team building, voc rehab, etc., for people of all disabilities. They work with DSPD funds and scholarships, and their goal is to make services available to all people regardless of their ability level, income, or place of residence. Also have here the National Ability Center, and they're located in Park City. It's about a 26-acre ranch with 20 different programs, as well as training for adaptive recreation, which is amazing. They serve all ages and all abilities, providing single and multi-day lessons that can include activities such as riding bikes, riding a horse, and they can also provide one-on-one lessons. They have custom group and family overnight experiences, year-round camps. They also do equipment fitting and rentals, adaptive horseback riding. They have transition programs and community events, and they also offer scholarships. I have here the Special Olympics Utah, which is special events for people of all ages with intellectual disabilities, intellectual and developmental disabilities, programming across the lifespan from toddlers to adulthood. They have one-day or weekend-style events through the entire year. One of the goals is to have people be seen, develop skills, to have meaningful relationships with their peers, to build a community. Costs can be a big barrier for families, so all of their events are free to participants. They will never have to pay a fee. Sports are offered year-round, winter, spring, summer, and fall. Programming is limited by age. They have traditional and unified sports. The traditional teams are made up of participants with intellectual disabilities, and the unified teams are people with or without a disability. For their younger participants, they have what's called the youth athletes, which is for kids 2 to 7, and these are unified activities, which are with family members or a friend. The next resource here is the Tanner Dance Group, and I did include the link for all of these with the 2026 summer camps. The program reaches thousands of children throughout Utah each year, and this is for neurodiverse as well for children and adults. It's adaptive dance, adaptive dance. It increases the opportunity for kids to interact socially, body awareness, problem solving, sensory regulation. It's creative dance for individuals with disabilities and are offered by age as well as a wheelchair class. Their curriculum is about the whole child. They can make adaptations when needed. Example, if the music is getting overwhelming or there are other sensory signs, allowing the class to continue to be a safe place for their neurodiverse participants. They also work with DSPD funding and have scholarships for their adaptive program, and they are located out of the University of Utah campus. So again, all of these slides have the links for everyone to be able to research and see what would be something that your families can take advantage of. Thank you.
Thanks, Sylvia. That goes well into, we had a great presentation last month from the National Ability Center, more in depth, getting people's minds thinking about recreation services for this summer. So that played in nicely with what the information we got last month and lots of additional resources too. So hopefully you're able to connect families with good recreation and social opportunities, not just in the summer, but year round. And just a reminder that all of these resources and all the slides, recording, everything is saved on our Trello board, which I will send out. If you're not getting the links to that, it means you're not on the listserv. So go ahead and drop your email into the chat if you want to be included on those emails. And then we will go ahead and move into our learning session. So today we're trying to get a better understanding of Medicaid and mental health services, and have invited Sarah Miles and Leo Colburn, both from the Utah Department of Health and Human Services, to join us. They're in different departments, so going to help us understand the link between those two, and we'll go ahead and turn the remainder of the meeting over to them.
Hi, good morning. My name is Sarah Miles, and can everyone see my screen okay? Perfect, thank you. Again, my name is Sarah Miles. I work in the Office of Substance Use and Mental Health. I specifically work on Medicaid policy and manage behavioral health policy for our Medicaid members in the state of Utah. I am a licensed clinical mental health counselor and also a nationally certified care manager. I've been working with Utah Medicaid for about 6 years now, and I've previously worked on Wyoming Medicaid contracts. So let's jump into it. Today, I'm going to be talking about Utah Medicaid, obviously. Going to talk a little bit about how our managed care plans work, how to become a Medicaid provider, some eligibility discussion, covered services, and some words of advice for you. So what is Medicaid? Medicaid is a state-run program providing healthcare coverage to low-income or specific populations. The Center for Medicaid and Medicare Services, or CMS, is the federal operation that tells states that they have to run a Medicaid program, and they set a bare minimum standard for what states have to provide. So they say that states have to provide these specific services to these specific populations, and then from there, states can add on to whatever programs or services they want to for their specific state and for their populations. Some of the ways that states are able to add on services are through what we call waivers. So waivers are the way in which states request special access or running like special programs or trial periods or for specific populations. And I'll also cover some of our waiver programs that we provide here in the state. Another way that we request like special permission from the federal government to provide services is through our state plan authority, or what we call the SPA. The SPA is our contract with the federal government, and it says that these are the services that we are going to provide to Medicaid members throughout the state of Utah. And we also include how we are going to pay for those services and which buckets those services will be paid through. So in Utah, who is eligible for Medicaid? So we have a couple of different categories. We have children, medically needy children. That's part of some of our waiver programs. Pregnant women, age blind and disabled, our adult expansion population, which is another waiver program, and also the targeted adult Medicaid program, which is another waiver program. When I first started with the state, and I was trying to understand how the different programs worked when it came to managed care, when it came to fee for service, and all of those different things, it was very, very hard for me to put things together and to understand it. So I came up with this little flow chart. So this is the inside of Sarah's mind. So hopefully this helps a little bit and doesn't confuse further. But let's jump into it. Now, I know that when we talk about carve-out services, there are many different ways in which people use the term carve-out services or carve-out. When I refer to carve-out in our presentation today, I'm going to be specifically referring to individuals who receive services through fee-for-service Medicaid, meaning that those services are paid directly by Utah Medicaid. They don't go through a managed care plan or anything like that. It just comes directly out of the pocket of the state. So in Utah, we have three separate models of payment for our Medicaid members, and this also includes how we manage our Medicaid members. So we'll start over here with fee for service first. And again, this means that all of the services are managed by the state. That means that, again, all of the services are paid for by the state. The reason why we have this category is to really open up services to our most medically needy populations or most vulnerable populations. So some of our fee-for-service populations include targeted adult Medicaid. For now, that will actually be changing in July 2027 when those services will go into a managed care situation. But the reason why we have the fee for service is so that individuals can access services through any approved Medicaid provider, any fee for service Medicaid provider. They don't have to go specifically through those plans. So that is fee for service in a nutshell. This middle section where I have accountable care organizations, this is what we're going to consider our traditional Medicaid program or our legacy population program, as some people refer to it. I like to refer to it as the OG Medicaid. This is the type of Medicaid that has been around since the inception of Utah Medicaid. Of course, we've had additional health plans that have come on board, excuse me, but this is just the original. This is probably for individuals who are working with children. This is the most likely brand or flavor of Medicaid that you're going to see with this population. So what makes this flavor of Medicaid really unique is that it manages, so you have a health plan and then you have a behavioral health plan, or where all of your behavioral health services are managed under one plan and your physical health services are managed under under a behavioral health plan. And then the physical health services are managed under a health plan. Individuals with this type of Medicaid, when they're eligible for traditional Medicaid, they are allowed to choose the health plan that they want, but they are assigned a prepaid mental health plan, which is who manages the behavioral health services. They are assigned that by the county that they live in. So unfortunately, if somebody wants to change their prepaid mental health plan that's only assigned by their county, they would have to have a different county of residence in order to be assigned a different prepaid mental health plan. Again, the prepaid mental health plans manage behavioral health and substance use disorder services. And so that includes all outpatient services, including detox services. However, when it comes to inpatient detox services or withdrawal services, the health plan is responsible. So you can see how it gets a little bit mixed up and how it's not so black and white when it comes to behavioral health and physical health services. So we've tried our best to separate the two and to try to designate them as best we can. But for the most part, just keep in mind that anybody who is eligible for our traditional or legacy Medicaid, they will select a health plan and then a prepaid mental health plan will be assigned to them. Now, over on the far side, we have our integrated care model. This is our adult expansion population, also a waiver population. With this type of Medicaid, this eligibility category, individuals in the 5 most populous counties in Utah. So that's Weber, Davis, Salt Lake, Utah, and Washington County. They are they're able to choose a health plan that they want. But all of their physical health services and behavioral health services are managed by that one plan. So rather than having a physical health plan and a behavioral health plan, everything is just under that one umbrella. And it sounds like for those of you who are interested in the upcoming training in learning how to become a Medicaid provider, that will be an excellent opportunity. I'm to learn a little bit more about our enrollment processes. I'm just going to give a very high level overview of what it's like to become a Medicaid provider and the enrollment processes. But if you want more information, I would strongly encourage attending the training that Lauren is going to be doing in the upcoming weeks. Utah Medicaid uses a program called the Provider Reimbursement Information System for Medicaid, and that stands for PRISM. PRISM is the new Medicaid clearinghouse that came on board in 2023. Sorry about that. And it is where we not only enroll providers, track all provider information, we also track member information through here, and it is our claims clearinghouse. So it has many different arms and many different extensions and different things that it provides. But in order to get enrolled with Utah Medicaid to become a Medicaid provider, first you need a National Provider Identification Number, an NPI, and then you can create a Utah ID account in the PRISM system from there. And once you start that process, there's a whole walkthrough application and also a trainings for you to engage with on the Medicaid website. And I've left the training link in here. There are tons of videos on how to become Medicaid providers and also walking you through that enrollment process that's really helpful. So I would just encourage anybody who's not currently enrolled to definitely take a walk around that website on those pages and view some of those trainings. When you do complete your PRISM enrollment, all the licenses you'll be providing services under must be uploaded at the time of enrollment. And that's super important to keep in mind. So if you are waiting for your license or if you're going to be providing like specific services under a specific license, you need to make sure that you're able to upload a copy of your license when you are enrolling with Medicaid. So eligibility verification. As a Medicaid provider, you are required to verify eligibility at the time of every service that you are delivering. So that means that you need to do enrollment checks every time that you are going to provide a service to a Medicaid member. And sorry, I have a little friend this morning that keeps bothering me. Hopefully it's not bothering you guys too much. Anyhow, when you do provide services, you do have to verify a member's eligibility at the time of every service. That is your responsibility as a Medicaid provider. There are 2 different ways that you can verify eligibility. You can do it through the Medicaid website through our eligibility lookup tool, which I'm going to show you what that looks like. Or you can also use the PRISM portal once you have your Utah ID account and are enrolled in the PRISM system. So for the Medicaid eligibility lookup tool, I've provided the route from the Medicaid website on how to access the eligibility lookup tool. And when I go over my words of advice, I'll explain why I gave the route rather than just giving the specific link to that site. But this is what the eligibility lookup tool looks like when you are logged in and looking up a member information. So in this provider ID section, you'll enter your NPI, and then you can use a method. It gives instructions where you can use one of these 2 personal information sections that are required. So if you do have a Medicaid ID, you can enter that in here. If you don't have a member's ID, you can enter their first name, their last name, date of birth. You can do a Medicaid ID number, first name, last name. So you just have to meet the requirements for those specific areas. And then the date of service that you are providing services. And once you get a positive result, this is what the eligibility lookup tool page will look like. So you'll see the member's name, you'll see their benefit plan type. This is that traditional Medicaid that I was talking about earlier. You can see the different health plans that they've been assigned to. So this individual has a health plan through Health EU, and then they've been assigned to Southwest Behavioral Health as their prepaid mental health plan, where they'll get mental health services or substance use disorder services. You can also see on this page if they have any co-pays that are required or any cost shares, any specific eligibility services and things like that. Further down the page, you'll also see if there are any restrictions or other insurance, or if they have a specific pharmacy that they need to bill to, or even if they have Medicare. Keep in mind that Medicaid is the payer of last resort. So if an individual has a primary or an other insurance through like the health, through the ACA, or if they have any other type of primary insurance such as Medicare, those insurances need to be billed first, and then everything that's left over can be billed to Medicaid. Our restriction program is a program that is meant to assist individuals with utilizing their healthcare in the most beneficial way. So that means that we are trying to teach people to not be super utilizers of certain facilities or different types of services. Really, it's not meant to punish, but really just a means to assist. So when somebody is on the restriction program, that means that they have one provider, one pharmacy. They can have other providers added to their list of available providers that they can go see, but that all has to go through their restriction care coordinator. Like I said, verify eligibility at every visit. This is a quote from the Section 1 manual. A Medicaid member is required to present their Medicaid member card before each service, and every provider must verify each member's eligibility each time before rendering services. I just listed some of our covered behavioral health services. If you are interested in learning more about behavioral health services, I would encourage you to review the Behavioral Health Services Manual located on the Medicaid website. That goes into more detail about the services, giving general information, any limitations for providers, provider requirements, coding and billing information such as that. And some words of advice. So I would encourage anybody who is interested in becoming a Medicaid provider, or even if you are a Medicaid provider, to sign up for our Medicaid information bulletins, which can be done on the Medicaid website. The Medicaid information bulletins are our way of communicating with all of our providers any upcoming changes to services, such as new services or even old services, like if we're making changes to who can receive those services and things like that. We release the Medicaid information bulletins on an every other month cycle. And then we'll also sometimes do special interim MIBs if there is specific information that we need to communicate. Once you register to receive those, you'll just automatically get an email once the MIB is released. Strongly encourage everyone to use the provider trainings on the Medicaid website for PRISM. Review the Medicaid member guide. This is the Medicaid member guide, gives specific information to our Medicaid members on the services that they can access, including how to access like transportation and things like that. And it's really just a good overview and understanding of how Medicaid works for our members. Again, use the Behavioral Health Services Manual. We also have the Autism Manual. That's really helpful. I don't specifically manage the autism program. There's a separate health program manager. And if there is interest in having that gentleman come and speak to the group, I can definitely work to get that figured out and scheduled for you guys. As I mentioned previously, the reason why I gave the route for the eligibility lookup tool, we're constantly changing and updating our Medicaid website as we get more information or as we make updates to our program. And so that means that if you bookmark a link on the website, it will break. And so you'll go to try to use the eligibility lookup tool and you can't access it. You think that it's broken, it's no longer working. Really, we just changed the link and made updates. So I strongly recommend not bookmarking any specific pages on the Medicaid website. Get to know and love the Medicaid website, and yeah, you can become a professional like me who learns something new at their job every single day. And that is all that I have for you guys today. I'm going to go ahead and turn our time over to Leah.
Thank you, Sarah. Hello, everyone. My name is Leah Colburn. I am also with the Office of Substance Use and Mental Health. I am a program administrator over mental health treatment services. I am also a clinical mental health counselor and have worked in community mental health for, I don't know, 15 plus years. I always have to think about that when I say that. So today I'm going to cover really briefly the Office of Substance Use and Mental Health, the local mental health authority system, or really the local authority system, touch on behavioral health services, crisis services, and a few other programs that are offered across our state. Let's see here. So just to kind of do a quick overview of who the Office of Substance Use and Mental Health is. We are Utah's Substance Use and Mental Health Authority. Our role is really to establish evidence-based prevention, crisis treatment, and recovery support services, provide oversight and policy direction to our local mental health and substance use authorities. We provide technical assistance, certifications, and training to the community, as well as providers that we are contracted with. We provide direction to the Utah State Hospital. We audit and evaluate publicly funded services and programs, and we partner and coordinate with public and private entities. You will notice on this that one thing that the office does not do is direct services. We do not do any direct services within our office. So if you call us and you're seeking services or seeking support, we will help connect you to someone in your area who does the service or a partner that we work with. Slide, please, Sarah. Just to cover kind of the overview of our office, as our office is quite large. We have a team that's focused on mental health services, both children and adult, crisis service administration, so the MCOT or mobile crisis outreach teams, or stabilization and mobile response, clinical suicide prevention. We have a team focused on youth and transition employment services, first episode psychosis services, which I'll go into in a little bit, individual placement and support. We also have a team focused on substance use prevention, substance use treatment services, opioid treatment, jail-based and specialty courts, women's treatment programs, and our suicide prevention team focusing on Live On Utah and Utah Suicide Prevention Coalition. When we talk about the local authority system, Sarah talked about it briefly in the previous presentation when we talk about prepaid mental health plans. But when we talk about our local authority system, the Office of Substance Use and Mental Health, has a contract with the county to provide prevention and treatment services. Statewide, there are 13 local authorities. Some are individual county-based, while others have many counties in their catchment area. The local authority, which is the local authority, can provide direct services, or they contract with independent providers. A really good example of that is Salt Lake. Salt Lake Behavioral Health Services, the county is the local authority, but they contract with Optum to then contract with providers. Thus, you have a large network. This is also the case in Tooele and Summit counties. Slide, please. Thank you. Sarah spoke about this, so I'm just going to briefly touch on this. So we operate under a capitated mental health system. Our local authorities are the prepaid mental health plan. Medicaid members are enrolled with the PMHP contractor serving their county of residence. Most of our local authorities do also accept commercial insurance. We do not have a list of that, so we do encourage you, if you are working with a family who maybe would like to work with their county local authority system, or maybe there's some programs and services that would meet their need, reach out and have that family give the area a call. That's probably the best way to do that. So how do you find your local authority? Well, it seems intuitive, like, hey, I live in Juab County. Where would I go? So it's not for some families that you work with. So you can go to our website, sumh.utah.gov. You can type in the county that you work with or work in, and it will connect you to the behavioral health provider, but it will also connect you to the prevention teams in that area. Some are through the county of the local authority, some are through the health department. So that is a good option for you as well. So I briefly want to touch on the services that the local authorities are required to provide to their residents or pay for. So it's either provide or contract for. So inpatient care, residential care, which the vast majority of them contract with a provider to provide that level of care. Outpatient services care, 24-hour emergency, medication management, psychosocial rehabilitation, which includes vocational training and skills developments, not to be confused with voc rehab. That is something very different. And again, encourage you to look at the Medicaid manual to get a good understanding of what the psychosocial rehabilitation skills are. Case management, community supports, which include for youth respite programs. Consultation and education, services to adults incarcerated in county facilities, in addition to partnering with the criminal justice system for adults who are perpetual offenders. Okay, Sarah, thank you. Slide. Just to cover the substance use treatment continuum, this is quite large and I'm not going to read it all, but just recognize that our local authorities have a very large array of substance use treatment services and prevention services in which they can provide and do provide across our states. So I really encourage you, if you're working with a child or a family who needs substance use services, to reach out directly to the county provider to see what is available in that area based on medical necessity. In addition to knowing what's available for substance use treatment, I do want to just highlight that all of our local authorities use the ASAM as the framework to conduct screening and assessment to determine the appropriate level of care for the individual. There's a separate ASAM for adolescents and one for adults. There is often some questions regarding funding for accessing substance use treatments. So all of our local authorities have funds available for those who are unfunded and underfunded through multiple funding streams. But they also accept Medicaid, health insurance, and self-pay. I do just want to highlight that we do have about 5 programs statewide that support pregnant women or women with dependent children for residential programs in which the child can attend with the parents. One of those 5 programs is actually specific for men. So those are available statewide, and more information can be found on our website with that. Those programs are very unique, as the child can also receive services when their parent is in treatment. Just to cover substance use prevention programming, our office oversees the SHARP survey, which is done every other year for students 6, 8, 10, and 12. The SHARP survey is one that is very important for getting data from the youth about what is going on and what is needed so they can thrive. The substance use prevention team also works really closely with community coalitions so that communities can drive responses for shared risk and protector factors specific to their community. They also support BOTFIN's life skills and guiding good choices programs, which are available in schools or in community health departments or youth services programs statewide. Our office also administrates the SMR program, Stabilization and Mobile Response. Again, we do not do the service, we contract out for that service. But just to remind folks, the Stabilization and Mobile Response is a free family-guided behavioral health intervention program for children ages 0 to 20. The goal of this program is really to help families maintain in their home with longer support than just that quick touch of a mobile crisis outreach team support. The SMR services are available statewide, except for in Summit, Duchesne, Uinta, Daggett, and San Juan areas. But I will note that MCOT services are available in those counties if a person does need crisis services. To access SMR, you can either call the direct line or call 988. So when we talk about adolescent mental health, I just want to highlight in this area that our system, the local authorities system, sees about 58,000 clients a year. So in fiscal year 25, they saw about 58,000 clients. 31% of the clients seen were youth ages 0 to 17. So when we talk about that, our system sees about 30% annually. That's a pretty stable number. But what our system does see are about 70% of the kids seen have serious emotional disturbance criteria, which really means that they have complex needs that are going on that will probably maintain for some time in their life. This chart here shows you on age ranges how many kids are being seen across the last 5 years. And if you want to see more data about who our system sees, I do encourage you to check out the SUMH data portal that is available on sumh.utah.gov. It's a very interactive data portal that can talk to you about adolescent mental health, adult mental health, substance use, etc., crisis services. Thank you, Sarah. So I do just want to highlight a couple specific mental health programs that we contract out to do statewide. The first is school-based mental health services. All of our local authorities provide some array of school services in their local school district or charter schools. And this is really dependent on the relationship and what the school district and the local authority have decided is a service array. But what is really great about school-based services is that while, yes, a student with Medicaid can access those, they also have funding available. So if a student who does not have Medicaid is unfunded or underfunded and needs mental health clinical services, they can be accessed in the school setting. So I encourage you to talk to your local authority about what is available regarding school services. We also at our office provide the certification for family peer support and youth family peer support. That service is so vital to help the identified child's family system thrive and really find connection with someone who has lived it and has walked in their shoes. We also provide intellectual and developmental disabilities and mental health clinical trainings. We provide clinical trainings for mental health professionals, but we also provide a monthly IDD webinar series, which is available to anyone if they want to build up their skills with working with an individual or individual with IDD or their family. We also have a provider lookup tool in which someone can look to see who in their local authority or other system has some specific skills to support IDD and mental health. And then we have specific resources for professionals and individuals. And I'm trying, Sarah, next slide, please. I also wanted to highlight our Prevention and Recovery from Early Psychosis program, or PrEP program. These programs we have 5 of them statewide, sorry about that. So in Weber, Davis Behavioral Health, Wasatch Behavioral Health, Volunteers of America here in Salt Lake area, and Southwest Behavioral Health. The first episode psychosis program is coordinated specialty care, while the clinical high risk for psychosis is stepped care services, and that is available across 4 sites, so statewide. And really the intention of this program is to help young people, 14 to 26, who are experiencing a first episode of psychosis, get early access to supports and services. More information can be found at utahprepteams.org. So coordinated specialty care is really a recovery-oriented program, like I said, that helps individuals with the first episode of psychosis, really promotes that shared decision-making and uses a team of specialists who work with the client and natural supports to create a prevention plan. I will note that when we talk about coordinated specialty care is that a client doesn't have to access all of the services. This program really focuses on meeting the family and the individual where they are and identifying what the greatest needs are. The clinical team around that client might actually be working a little harder than the client at the initial onset of engagement in the program. As sometimes the engagement phase can take up to 6 months before the family and client are fully invested in the work. But we are seeing some really great outcomes and continually exploring how to expand knowledge for first episode psychosis across the entire state. Those are some programs I wanted to highlight. Any questions for myself or Sarah?
Just a final note, I am going to put an email address in the chat, and it will be our DMHF medical policy inbox address. And so if you ever have questions about Medicaid policy, about manual information, or anything along those lines, you're more than welcome to send an email to that address, and we would be happy to answer for you.
I see, Sylvia, you've got your hand raised. Did you have a question? You're on mute, Sylvia.
I just wanted a brief description on how ABA therapy is not paid under their mental health benefits, but is separate. It's paid differently. Just so we could explain this to families, because a lot of times they'll call and say, well, I was told I have to go here, and ABA therapy doesn't work that way.
Yeah, so that's one of those programs, Sylvia, that is paid by fee for service. And so that means that it comes out of the pockets differently. Again, like I am not the professional on ABA, and so like if you guys would want somebody to speak more to that, we can definitely arrange for our program manager Kirk to come and speak to that. But I would also refer you to the autism I think it's the Autism Services Manual, where that does explain a little bit more of how the payments work for ABA therapy. And you can access that through the Medicaid website, and then go to the providers tab and go to provider resources and information. So that's medicaid.utah.gov, and then provider resources and information, and then manuals. And you'll be able to access the manual from there.
So that's the same as the provider manual for ASD services.
Uh-huh. Yep, correct.
Thank you.
Uh-huh.
Jesse, you've got your hand up as well.
Yeah, I wanted to thank you guys for a great presentation. Thanks for all of the information. I have a question specifically about the substance use disorder stuff through the counties. So it seems that is a black hole when we're trying to guide families to to access help for their kids with substance use disorder. Do you have any? So a lot of times they haven't already accessed services through the county authority. Is there a specific thing we should be asking for or guiding parents to ask for as they contact the county authority? Do they contact the county authority directly, or is there like a
Ingrid, you seem to have muted yourself.
Sounds like her service might have just dropped, but can you answer
Did.
based on
Yeah,
what
sorry
you
about that.
asked?
No, it's okay. So, what I would suggest is contacting the local county provider in the county of residence. I will just say that when it comes to youth substance use treatment, we have found, and data really suggests that less and less kids are actually accessing that type of service. So oftentimes parents are thinking my child needs a residential program for substance use treatment. I really encourage parents when they call in and say, "Hey, my child has a substance use concern," to really go in with an open mind related to they're going to do an ASAM, they're going to seek what's the best level of treatment and care for that child. But I really start with kind of this is what's going on with my child and this is where we're at. I will also say too, in substance use treatment, that the young person has to be involved in that treatment. They have to be willing to engage in treatment. And I think sometimes that can get really tricky for parents when maybe the viewpoints are a little bit different. So again, I'd have the parent contact the local authority and see what programs are available and, find and communicate with them of how do I engage my child if maybe my child's a little pre-contemplative and not interested in treatment services.
Dusty, did that answer your question? Because it sounded like you were already at the point of where you've reached out to the local mental health authority and and there's some confusion on what the services are that are available.
It does answer my question, not necessarily confusion. It just
Okay.
feels a little nebulous as you're entering into that.
Um, Ingrid, you have your hand up before you hop on and ask your question. I do want to just make a shout out for anyone here who has to drop off at 9:30. We'll stay on and do questions until while we can, but our meeting next month will be on residential treatment programs, actually, so that might help answer some questions as well. And specifically, we'll have some highlights from Odyssey House and House of Hope coming to speak specific about their program. So, Ingrid, do you want to go ahead and ask your question?
Yes, I thank you so much for the presentation. And I just have some questions about CHIP and mental health services for patients. And I don't know if you guys may have some answers about that, or do you guys know someone that may have answers about that? I just feel like um, it's different,
It
and
is.
we run into different answers. And even with the local mental health authority in the county, um, we we run into some barriers too. And with the different, and I don't know if it makes a difference with the different kinds of chip there are too, like Chip Molina and Chip Select Health, and now there is a Chip Healthy You as well. So if you have any information about that, or if you guys could refer us to a person who knows about that, that'll be great. Thank you.
Yeah, Ingrid, thank you. And yes, CHIP is a very unique program and has a lot of different elements to it. I did post our policy address in the chat. And so if you want to send an email to that inbox, just asking for a contact for the CHIP program, I can respond back to you with a good contact and some good information on the CHIP program to hopefully get you some answers.
Okay, sounds good. Thank you.
Of course.
Sorry, my name's Taylor. I couldn't find my brain study, but so I apologize. I did also want to ask or have maybe some questions too on the CHIP as well. I'm a nurse with the state. We work with DCFS. I do care coordination, foster care. we don't have many kids with CHIP, but I have had several. Um, so is it possible to even have like that contact like sent out to all of us, or is it better to like send the individual email requesting that information?
Yeah, you can always send an email to that inbox. That's absolutely okay. But I can also send information to Athena on the CHIP program to be shared on the listserv or through your Trello board. I can definitely do that for you guys as well.
It
And I
sounds
guess
like
for that oh, sorry, I was just gonna say for like to be that immediate, some of the stuff I found out within this last year trying to find specifically mental health providers for CHIP was that it's billed through the medical plan. So where that traditional Medicaid has that mental health portion, the CHIP does not. So it's kind of like I have PhD, my mental health services are billed through my medical plan. And that in itself proved very difficult in finding providers. I've had more luck in like Salt Lake County because it's Optum. One thing very confusing too, and I've reached out to several providers, including county providers, is if you go to like if you go to the websites for like Select Health Community Care or Healthy U, and you use their search to find find providers that take CHIP, it'll show that they take CHIP. However, they don't, because it's like the system doesn't separate it out between the providers that may take Select Health Community, like Select Health or Select Health Community Care, but they don't take the actual CHIP portion. And so, and like, for example, Wasatch Behavioral was one where the website showed providers that took CHIP. However, they don't actually have providers that take CHIP. So I maybe that information is helpful or not. I just, since I had it, wanted to share it.
Yeah, and I hear you, Taylor, like having done care management, like I totally know how that plays out. And the beauty of having a find a provider tool is that you have that information. The unfortunate reality is that providers don't keep that information up to date. And they often make changes to their coverage and move along and move out of state or do whatever. And so it's really hard to keep those find a provider tools up to date. Unfortunately, that's an endemic problem that we're dealing with all across healthcare and including on our Medicaid find a provider tool. I do recall on the Select Health Find a Provider tool that they did have a drop down for CHIP, but it's been a minute since I've looked at that, so that definitely could have changed. But when I reach out to the CHIP program manager, I'll also ask them if they do have a good Find a Provider resource to utilize. I will also say that families can definitely reach out to their individual plans, whether that's through CHIP or through any of the traditional Medicaid programs, and ask for assistance in finding providers. Most of those plans like Select Health, Healthy U, Molina, they all have care managers or care coordinators or even care navigators that can assist in finding providers too.
And Lauren, is this some of the more detailed information that would be covered in your training, or should we look at having additional maybe representatives from the CHIP program specifically come talk, and then it sounds like the person over autism services as well might be beneficial for our group. Oh, she chopped off. She was on. I'll ask her over an email.
All right, not a problem.
Uh, well, this is really great. I need to hop to another meeting as well. So I'm going to call it there, but thank you so much for coming today and presenting to our group and for the great questions that you were able to answer.
Certainly our pleasure. Thank you.
Thanks, everyone. We'll see you in July.